All right. Welcome to Chapter 16, Nutritional Aspects of Pregnancy and Breastfeeding. This is one of my more favorite lectures. It's a pretty amazing time of life. It's kind of fun to talk about. There's a lot of nutrition things to consider during pregnancy and breastfeeding. So here's the list of our objectives. These, of course, will be on the final exam. We're going to start off by thinking about the factors that predict a successful pregnancy outcome. So, what exactly does a successful pregnancy look like, and what can a pregnant woman do in order to achieve that? We're going to talk a lot about the physiological changes that occurred or in the body during pregnancy. Again, it's pretty remarkable. Because of those physiological changes, you're going to have to know how the nutrient needs are also altered. Uh, in a nutshell, we need more of a lot of things to support growth of the fetus. We're going to talk about optimal weight gain during pregnancy, and you will have to know the recommendations. We'll describe the special nutritional needs of lactating in pregnant women, summarize the factors that put them at risk for any nutritional deficiencies. We're going to talk also about nutrients that need to be supplemented. So we have something called prenatal vitamins, so thinking about what might be in those. Special nutrients also needed during lactation. We're going to go over a few nutrition-related problems that occur during pregnancy and suggest techniques or recommendations for coping with those problems. We're going to go over the substances and practices to avoid during pregnancy and lactation and describe why they are harmful. And then towards the end, the physiological process of breastfeeding. So first, let's talk about pregnancy. You can see a newborn infant in the picture there. When we talk about gestation, that is the time that a woman is pregnant. So the time she conceives till the time that she gives birth. This is actually extremely important when you think about that first objective about a successful pregnancy. We really want women to go full term, so be pregnant for at least 37 weeks before she gives birth. And one of the nice things about having a full term pregnancy is that you will be more likely to have an infant weighing greater than 5.5 pounds. If it's less than 5.5 pounds, it's going to have much higher risk for health issues and not having full development. A preterm baby is one that was born early. A lot of people call those preemies. So any baby born before 37 weeks is a preemie. A baby that's born too small is considered low birth weight. That's if the baby's born less than 5.5 pounds. Again, that puts them at greater health risk. You could also have something called small for gestational age. So that means, maybe the baby actually went full term, but they were still smaller, weighed less than we would have liked. We are now going to be thinking about prenatal development stages. So this is leading up to the time of conception. So there's a couple of things that have to happen before a fetus can start to grow. Conception is the moment where the sperm meets the egg. And so in order to, of course, create a fetus that's eventually going to turn into an infant, we need the sperm from the male and the egg from the female, and those two things have to meet. When they meet up, you get a zygote, which is sort of the fancy word for a fertilized egg. You look down at the picture here, you'd recognize this as a female and her reproductive organs. This is the uterus, where if the zygote, that fertilized egg, travels to and implants itself, this is going to eventually turn into not a zygote, but eventually a fetus and the infant. This is how it starts out for a female. We have two ovaries. This is just showing one side. Those ovaries eventually turn into the egg. Ovulation is the time in a woman's menstrual cycle where the egg is ready to be fertilized. It gets released out into these fallopian tubes, and if sperm meets egg, During ovulation, those cells will immediately start dividing and developing because, again, they are eventually going to turn into um, the fetus. I keep saying the word fetus. There's actually a stage before that, the embryo. Again, those are the early days when you first become pregnant. And when we talk about these developmental stages, the time in which a woman is pregnant, we usually divide it into trimesters. So if you think, excuse me, if you think about being pregnant for 9 months, if you divide that by 3, you've got first trimester, second trimester, and third trimester. And so some of those time periods are more critical than others. I'll talk about that in a second. Um, there's also some time during pregnancy where you're at higher risk for what's known as a spontaneous abortion, which means um, the body spontaneously, so kind of unexpectedly or out of what seemingly nowhere, aborts the pregnancy and it doesn't continue on. You might have probably heard that called a miscarriage as well. Here's a very busy slide, but it gives you a lot of really important information. Here, if we kind of orientate ourselves, we're talking about preconception, um, what is happening, but when conception starts, it's when the sperm and egg unite. Here we have the very first stage, which is the zygote stage. This is just simply cells dividing. You wouldn't even be able to see it with the naked eye. The embryonic development is the first 8 weeks of pregnancy, and this is happening during the first trimester. So technically, the first trimester is the first 12 weeks. And they lump together the second and third trimesters here, but obviously, as that embryo turns into a fetus, it's starting to look more and more like a baby and getting ready for delivery, anywhere after 37 weeks, hopefully. This is circled in red, and you see these long lines, and it's talking about all the things that are developing. The big point of this is the first trimester is considered the most critical time frame of a pregnancy. This is when all of these cells are dividing rapidly and they're differentiating, which is kind of a fancy word for turning into what they're ultimately going to be. So even though it doesn't look like a baby yet, the cells that are going to be part of the central nervous system, the heart, the limbs, the eyes, the ears, the palate, the teeth, and the genitalia are well under development. And so this is a critical time for everything to go normally, for good nutrition to be happening, for mom to be avoiding things that might be harmful, um, because if something goes wrong here, the pregnancy will end in a miscarriage potentially. And so very, very critical how it gets its name. So thinking about what mom should be thinking about um, in terms of nutrition, nourishing the zygote, embryo, and fetus. So during the zygote phase, those very early times, nutrition really isn't all that important. This is again just sort of cells growing and dividing, and the fuel for that is actually absorbed from the uterus and the uterine lining. So we haven't developed yet a system for the zygote to get nutrition from mom or mom's diet. It's actually getting it from simply the organ, the uterus. Once you get to the embryo stage a little bit later on, around thinking about those first few weeks, you'll start to get nutrition from mom. So that's what this is. This is the placenta. This is the organ that grows only during pregnancy. It's connected to the embryo and later the fetus through the umbilical cord. So when the baby is born, is delivered, They have to cut that cord, that umbilical cord, and they now get nutrition without needing the placenta. The placenta is extremely important in order to nourish the embryo and the fetus later on. So here's another important slide thinking about nutrient needs and kind of the understanding that they will change throughout the pregnancy. Not surprisingly, energy needs increase during pregnancy. Pregnant women should be eating more than when they weren't pregnant because they use that extra energy to help support the growth and development of the zygote embryo and fetus. The most calories come towards the end. So the first trimester, the first 3 months, most women don't need to eat additional calories unless they were underweight. Think about that there's really not, there's, there's cellular things going on, but there's not any sort of critical mass. The embryo and the zygote don't have sort of pounds themselves. They're too small. Once you get into the second and third trimester where you're really starting to put on significant protein and muscle in the fetus, then you absolutely need the extra energy or calories for that. So it's roughly works out to about 350 extra calories a day and about 450 in the last trimester. Those are very loose estimates. I don't know many pregnant women who count their calories. It's going to depend on lots of things like mom's weight, how much weight she should be gaining, and her activity level. But what we do know is what those calories are made of. So what mom's eating absolutely does impact the baby's future health. Not only is it important for having a healthy pregnancy, but we know that what mom eats while she's pregnant actually can influence the baby's future risk of diseases. So kind of a lot of pressure on mom to be very healthy during this time. So in terms of macronutrients, those energy yielding nutrients, we know that protein needs increase. That kind of makes more, I think, a lot of sense because you're going to be in positive nitrogen balance, right? Because the fetus is definitely going to be putting on protein as its body develops. We also know we need more fat, especially essential fatty acids that are very critical for brain and eye development. We'll really be starting to thinking about omega-3 fatty acids for that purpose. The best source of fats during pregnancy. In terms of micronutrients, they're all important, but we really care a lot about B vitamins, especially folate and B12. If you remember back to the water-soluble vitamin lectures, both of those are involved in DNA. So that sort of genetic code that's really the blueprint for this fetus to grow into a human. We actually started fortifying our grain with folate specifically because we know that folate is important for pregnant women. We need folate in order to prevent neural tube defects. It's also been known to protect against heart defects and Down syndrome. So very, very important vitamins during pregnancy. Zinc's also one that's important. This is a mineral, a trace mineral. We don't have a lot of problems with zinc in the United States, but in places that do, or someone who might have a zinc deficiency, a severe deficiency can cause birth defects. It can cause growth retardation in the fetus, so it's not going to grow the way it's supposed to. It can cause a premature birth and a miscarriage, so also important. Iron deficiency can be very common during pregnancy. Mom's needs increase significantly. Her blood volume expands a lot, her maternal red blood cells, and you also need iron to build up for the fetus as well. They actually need that iron even after they're born. So some of the things that happen physiologically, you actually don't get your periods while you're pregnant. And a lot of times, if you're breastfeeding, you won't as well. So for iron, that's good. You're not losing blood, and that's going to help you keep up your iron store. We also absorb iron better while we're pregnant because I think it is such an important mineral. Um, it's hard to figure out what someone's iron status is. So it says here physiological anemia. That's because your blood volume has expanded so much. Your iron is diluted, so that the blood test can be more difficult to interpret. So to know if that's the problem or if there's a true iron deficiency anemia, you really have to be careful about that. Most women will have to take extra iron, sometimes even beyond what's in the prenatal vitamins. They will probably upset her stomach and make her constipated. So you have to think about all of those things when you're thinking about iron and iron supplementation. Other important micronutrients. This is for bone and teeth, both for mom and for the fetus. Calcium and vitamin D are two important nutrients for that. We actually don't have extra needs for those, but it's really important to meet the standard recommendations so they don't get depleted. My mom always likes to remind me that she never had any cavities until she was pregnant with me. So you do have to be more careful during pregnancy. This is especially true for kind of high risk groups, so vegans who avoid any animal products, including dairy products. Pregnant teens, they have higher needs because they're also putting on their own bone mass. People with hypertension or people who avoid dairy products. We have to be careful about all of those groups. So talk a little bit about specialty supplements. Prenatal vitamin is a vitamin and mineral is a just like a multivitamin, but it's very specific for a woman who is pregnant. They are ideally taken before you even get pregnant to help build up all those nutrient stores. Recommended that you take them all during your pregnancy and even after the postnatal period if you are breastfeeding. I'm not often a big advocate of supplements, but I do highly recommend prenatal during all of these times. It's really hard to get all that nutrition through diet alone. You have to be um, absolutely perfect, and even then it would be very difficult, especially for those very important folic acid, as long as well as the other B vitamins, zinc and iron. You do have to be careful about vitamin A. If you remember, that's that fat-soluble vitamin that can be quite toxic, and high levels, which you can get through supplements and even sometimes skincare products, can also cause birth defects. So this is a case where too much is bad. Other things that you'll often find in prenatal vitamins, DHA is a special type of omega-3 fatty acid that's thought to be very good for brain and eye development for the fetus. A lot of women experience nausea and vomiting during pregnancy. And there's not many things you can take safely, but some more natural remedies, including ginger probiotics and vitamin B6, may help with that. A lot of women will talk about having cravings during pregnancy, and people kind of wonder, well, does that mean something? Like, I really want pickles. Do I have a salt deficiency right now? Salt and pickles is kind of a common one that people talk about, the same as ice cream. Is it my body telling me I need more calcium? The research pretty much says no, that the cravings aren't often telling you something, um, but that doesn't mean that it's okay, of course, to have a pickle if you're really craving it. The one craving that is actually dangerous, it's kind of an odd physiological thing that happens called pica or pica. I've heard it pronounced both ways. And this is a drive or a craving to eat non-food things. When I talk about this, a lot of students have heard about it. They used to have shows on television of people who like to eat things that weren't food, like laundry detergent, cornstarch. Those are the most common ones I've heard of. But when you eat non-food things, they can have toxic things. So you do have to be careful about it. A lot of women are embarrassed by it. They know that it's odd that they want to eat those things, but there are kind of behavioral treatments that a healthcare professional could help you with. A little bit about physical activity. It is almost always recommended during pregnancy. There's a lot of benefits. I always tell people giving birth is one of the hardest workouts I've ever had, and I've been pretty athletic for most of my life. So you want to be in decent shape when the time comes. So you want that good cardiovascular function. More exercise has been associated with an easier and faster labor. And we know that it helps prevent something called gestational diabetes, which is diabetes you get during pregnancy, that you can get. Not everybody does, of course. It's also been shown that there's benefits to babies. They tend to be leaner and more neurologically mature, which is usually going to help with things that parents really care about, like sleep and crying and things like that. You do, of course, have some guidelines. This isn't a time for like heavy or strenuous training. We're really focused more on moderate activity. You are often more flexible to the point where it can be dangerous and you can hurt yourself, so you have to be careful. You don't want to lie flat on your back. That's actually true for sleeping as well. It's harder to get oxygen flow to the fetus when you're lying flat on your back. And of course, anything that's going to potentially cause trauma, horseback riding, boxing, downhill skiing, even, probably not wise during this time. So here's a list, and we'll talk about it more in detail, but these are the nutrition-related factors that we know affect pregnancy outcomes. So things that we want to be aware of. I'll give you more detail about weight and weight gain and the pattern of weight gain. Those are very important predictors of the health of the pregnancy and something that a pregnant woman has to be very conscious of. We know that young, especially teenage pregnancies, because they might still be growing themselves, have a lot of risks and would definitely need extra support. And then we also have to think about eating patterns, especially if something like hypertension or diabetes has developed. I've always liked this slide. I show it in most of my classes when I talk about this. It is from your textbook. And it's showing you where the weight gain comes from. My mom also used to tell me this story that, this was quite a few years ago that she was pregnant with me, and the medical advice was different at the time. And she claims her doctor told her that, when she had me, I'd be about 8 pounds, and I was. So she should really only gain 8 pounds during the pregnancy, which was horrible and not even safe advice. Women are supposed to gain weight during pregnancy, and some of that is going to come from fat. And a lot of women don't like the idea of gaining fat, but that's needed. You need that energy source, especially towards the end when the fetus is really growing rapidly. Um, your uterus, where the fetus is growing, is obviously getting bigger. To accommodate that, your breasts will get bigger. That's normal. That's to get ready for lactation or breastfeeding. Your blood volume, we talked about that with the iron, that expands greatly. It puts on 4 pounds of additional blood, which is kind of astonishing. And the fetus, of course, is going to weigh a lot, but also the placenta, that organ that helps nourish the fetus, and the amniotic fluid that surrounds the fetus are going to account for even more weight. So you don't have, this stuff absolutely needs to happen. The fat stores is variable. It's going to depend how much your pre-pregnancy weight is in terms of how much body fat should be put on during pregnancy. So some of you might have an old version of the textbook, although this is getting really old. But the weight gain recommendations are based on mom's BMI before she was pregnant. So this is an important thing to know. You have to know what mom's BMI was, and based on that, it will tell you how much weight you should gain throughout the whole pregnancy. And this should kind of be common sense. If you were light and you had a low BMI, you need to gain more weight, anywhere from 28 to 40 pounds during the pregnancy. If you're normal BMI, 25 to 35 pounds. Higher BMI would be considered overweight, would be 15 to 25. And if your BMI is greater than 29, we used to say 15 pounds. Now we've gone all the way down to 11 to 20 pounds. So even if someone did have excess weight, we still have weight gain recommendations. They're just going to be on the lower end, presumably because there's already stored energy, stored fat before the pregnancy that can be used during the pregnancy. Some other things that we know will affect the outcome of the pregnancy is mom's overall health. This would be definitely a part of a visit to a doctor to understand prior pregnancies if she's had them, to get good prenatal care, and to screen for things. One of the things that we screen for quite a bit is hypertension or high blood pressure that can develop during pregnancy, sometimes even after pregnancy. The name for that is preeclampsia, and eclampsia is the more serious version of that. Sometimes the blood pressure can get so high that the mom can start having seizures, which is incredibly dangerous. So they really have to keep an eye on that blood pressure. I always show this picture for gestational diabetes. I think that's like the cutest baby in the world. But it's a newborn, so it is a cute baby, but he was far too large. Whenever you see a really big baby like that, it's probably because mom had gestational diabetes. So this is kind of like type 2. It's called gestational because it's a specific type of diabetes that happens to a woman who was not diabetic before pregnancy but became diabetic during the pregnancy. It's actually fairly common, 4 to 7% of pregnancies. The risk factors, so we tend to see it in people who have a strong family history of diabetes, people who had obesity before they were pregnant, older than 25, and if they had gestational diabetes before. This is a condition that usually starts about halfway through your pregnancy. They'll start screening for it right around the midpoint. And it does have some serious consequences. It can deplete iron stores, so lead to iron deficiency anemia. Large baby, that's what you're looking at here. That extra sugar sort of fuels excessive growth, which you can imagine might not be fun for delivery. It's probably going to have to be a C-section. And because the fetus had so much sugar during the pregnancy, there was also a lot of insulin. So when the baby's born, their blood sugar actually drops, which can be very dangerous. In a perfect world, this doesn't happen. If it does, it should be detected early. And they will recommend exercise for mom that'll help her blood sugar come down more naturally. Low glycemic load, we talked about that early in the semester when we talked about carbohydrates. If you need a reminder, that's just foods that don't make your blood sugar go up too high. And in terms of medications, if it's really hard to control, Mom might have to inject herself with insulin. Most of the diabetes medications are not approved during pregnancy. So, if at all possible, managing through exercise and diet would be ideal. Some other socio-cultural factors, things that we've done in the United States to try and help women, especially lower income women, to have a healthy pregnancy. The Expanded Food and Nutrition Program is one federal program. WIC's probably the most famous. This is Women, Infants, and Children. It's also a federal program where they provide screening and nutrition education and free food for pregnant women. Food stamps can also be used to help purchase food if someone needs some financial help. In terms of things to avoid, pregnant women do have to be more careful. One of the things they have to be careful about is the type of fish that they eat. There's mercury in some types of fish, especially like tuna. Some types of tuna can have a lot of mercury, or swordfish tends to have a lot of mercury. So she can't eat all fish, but most fish is okay. She is more prone to foodborne illness. So foods that have bacteria or viruses in them, they might make you or I sick for, 24 hours, but they can be very dangerous for a pregnant woman or her fetus. That's why um, that's why women have to be careful about eating raw food. That's not a time to have like sushi. Even deli meat, they're supposed to microwave. Animal feces, they wouldn't eat that, but they're not supposed to be cleaning out the litter box, for example, and soft cheeses that aren't pasteurized. They also have to be careful about caffeine. They're still allowed to have it, but they're keep it under about 2 cups of coffee a day. Food additives, I put here artificial sweeteners. Those aren't officially banned, of course, but just kind of think about, just about anything the pregnant woman is eating, the fetus is exposed to. So you do have to be very careful. Other things you have to be careful about is alcohol, which is not recommended at any time throughout the pregnancy. Drugs, even over-the-counter ones like aspirin and cold medications, allergy medications, you should ask about and make sure that they're safe. Herbal and botanical products, you also want to run by your doctor. Nicotine, so smoking, vaping, carbon monoxide, all of these are dangerous for anybody, but especially dangerous for a pregnant woman. All right, we're getting now towards the end and thinking about common things that might happen during the pregnancy because of the physiological changes. The list here: heartburn, constipation, nausea, vomiting, and edema. Um, they could happen at any point. They're kind of out of order. So heartburn is very, very common. It usually happens towards the end, and it's because this is starting to take up a lot of space, so it's going to put more pressure, which is going to cause the stomach acid to kind of back up in the esophagus. So you kind of have to eat smaller meals, avoid anything like acidic or anything that makes your heartburn worse. You have to be careful about. It's not dangerous, but it's certainly uncomfortable. Constipation can happen anytime. It's often because of the iron and the prenatal vitamins, but it might also just be because of hormone changes. So making sure you're drinking water and having your fiber and getting your exercise will help with that. You're not supposed to take laxatives, so you try and find more natural measures. Nausea and vomiting probably should have been first on the list. That's usually the worst in the first trimester. So it's definitely because of the hormone changes. So trying to eat kind of bland, boring food, small meals. Usually this goes away though after the first trimester. Edema could happen at any time. It tends to be worse towards the end, and that's just because you have more fluid during pregnancy, so it's going to start to to build up a little bit and make you feel kind of puffy. This is usually especially true in your feet, just because of gravity. It tends to collect there, especially by the end of the day. Just kind of a blow up, and kind of a fun picture to see what's going on. To me, this one makes the most sense when you think about the calorie needs, right? Not a lot of increased calorie needs here, starting to need a little bit more. And then by the end, when you go from this size all the way up to this size, this is why you need like 450 extra calories a day. Not quite eating for two, but definitely eating more. And now we're going to think about what happens after you have the baby. Lactation is another word for breastfeeding. Like most physiological things, it's driven by hormones. So one of the really important hormones is prolactin. This is released after you've given birth, and it's a very important hormone for milk production. I remember the P's. Prolactin helps with milk production. The more the baby is sucking, so thinking about how a baby breastfeeds, expressing the milk from the mother's breast, the more prolactin is made, and so the more milk is made. So it's really a pretty smart physiological system. Um, Mom will supply whatever the baby demands. So whenever the baby's hungry, she would breastfeed, and that ensures that she will have enough milk produced. So not only does she have to produce the milk has to come out or get released from the breast. That's triggered by another hormone called oxytocin. When the milk comes out, we call that the letdown reflux. So both of those are really important. The milk itself is pretty amazing if you've ever seen it, or because mothers can pump it, and so other people can feed from a bottle. The first milk that comes out is something called colostrum. It's actually not milk at all. It's kind of like this orangey looking stuff that only happens the first few days postpartum. It contains a lot of really healthy things for the baby, including Lactobacillus bifidus. That's really important for the baby's immune system and getting them healthy. Then we kind of have this transitional milk, and then we have the nice mature milk that can be used for as long as the woman chooses to breastfeed. In terms of the nutrient needs during breastfeeding, mom still has to be careful about her diet and eat very healthy. Because she's making fluid, she needs to drink fluid herself. 32 ounces more than before, so she really needs to be drinking all the time. It's very easy to get dehydrated when you're breastfeeding. The other thing she'll need a lot of is calories. So, metabolically, in order to produce that milk, you actually burn a ton of calories, 800 a day. So it can help you lose weight, especially if you have to lose any that you gained extra during the pregnancy. The recommendation is to eat more because you do need extra energy. But if you don't eat the full 800 more, then that would allow you to lose weight if you need to. And of course, most women do after they've given birth. Other food choices to think about during lactation. She will have higher needs of certain nutrients. Calcium, magnesium, zinc, folate, and B6 tend to be problematic. So making sure you're getting, dairy and whole grains and nuts and seafood, leafy greens, all those good things. Omega-3s are still important, so um, again, fish or having the prenatal with the extra DHA. Nuts used to be warned about because of allergies. They no longer give that warning. It doesn't can actually make food allergies worse, so it is okay to have nuts during while breastfeeding. Alcohol, you have to be careful about. Alcohol can get into breast milk. So if you drink it, it can't be at any time around when you're about to breastfeed. So um, some caution there. I just want to put a plug in for breastfeeding. If you go on to take life cycle nutrition, we'll talk a lot about this. It is the preferred um, way to feed an infant if at all possible. So it's definitely good for infant health, but we know it has some benefits for mom too. It does help with recovering from the pregnancy. The hormones used to make the breast milk and cause the letdown reflux actually help the uterus get back to normal. It does reduce mom's overall risk of ovarian and premenopausal breast cancer. It does help you lose weight. Um, for most women, while they're breastfeeding, they do not ovulate, and so it's harder for her to get pregnant again and kind of have those back-to-back pregnancies. Um, it does help with bone remineralization, so keeping that bone mass up. It does help stop the bleeding that happens after you've given birth, and reduces your risk of metabolic syndrome later in life. So good for immediate health needs and long-term health needs as well. For infants, the big thing is for their immune system. Mom's able to pass on some of her immunity through her breast milk, especially in developing countries where they don't maybe have the cleanest water, um, and they need stronger immune systems. They have less infant mortality if moms are breastfeeding, fewer acute illnesses, so think about like colds and ear infections. We also know that breastfeeding is associated with less chronic illness, so impacting the baby's life even long term. So a lower risk of celiac and irritable bowel, lower risk of allergies and asthma for breastfed babies. And some evidence that shows that breastfed babies might have a lower chance of obesity later in life. There's actually a couple of slides about this, so lots and lots of benefits. Cognitive benefits, seems to help with brain development. Socioeconomic benefits, because their immune systems tend to be stronger, there usually is fewer doctor's visits. It's very soothing for an infant to breastfeed. There's a lot of bonding that happens. And if they do have like an earache or something like that, it can help soothe them. Oh, that ended abruptly. So lots of good things about breastfeeding. Again, highly encouraged if at all possible. Of course, it's not for all women. I wasn't breastfed, and I think I turned out okay. But if you can do it, then we would encourage you to do that if you ever have a baby. All right, so we'll stay tuned. We'll turn next lecture about kids and their nutritional needs. Get out of here.